Let's go to our second page. She's 67. She's got symptoms of hot flashes followed by severe sweating. She puts her hand in the freezer when this happens. Now, I guess it's so cold up here that y'all don't really have to do that much, do you?
Oh, yeah, we do.
Okay. She's got headaches, vaginal dryness, dysphoric, weight gain. This is my heaviest weight ever. Cognitive changes, increased joint pain, poor sleep, food cravings, dry hair, dry skin. She had natural menopause at age 48. She was on Premarin for 2 years, and then she was switched to Prempro. And she states an inability to effectively communicate with her physician. She says, I tell him this, but he just keeps writing the same prescriptions, every time. Just not as simple, you're just getting old. Okay, in the interest of time, we'll go on, speed through that, the next slide. So these are the medicines she's on. She's on bisphosphonate for osteopenia. She's been on 7 years, on a statin for 5 years, on synthetic thyroid for 10 years, blood pressure medicine for 15 years, and COX-2 inhibitor for 15 years. And this is the kind of spiral that we tend to see in midlife women. They start out and they're doing pretty well, but then they may have a regular period, so they're put on hormones or birth control, and they gain weight, become depressed, so they're put on antidepressant, anxiolytic, statin, then anti-inflammatory drugs, and you see this kind of downward spiral. So then in a matter of 10 or 15 years, they gain 10 or 15 or 20 pounds, and they're on 8 or 10 or 12 prescription drugs, and they're at their highest weight ever, and they feel worse than they've ever felt in their lives. And this is a common theme that I hear. So she's got osteopenia, hypertension, hypothyroidism, osteoarthritis, had a couple of surgeries, long had a history of uterine cancer, colon cancer, and now has dementia. Dad died of lung cancer. She's been retired for 5 years, high school education, living with her husband, no pets, no exercise, no tobacco, no alcohol, eats at home, 4 cans of soda a day. She's a caregiver for her mom. She's got decreased stamina as well as these abnormal skin sensations, kind of like bug crawling or electrical shock sensations she describes. Next slide. On physical exam, she's obese, her blood pressure is okay, waist circumference is high, she looks older than her stated age, her thyroid is enlarged, she's got fibrocystic changes in the breast, she's got atrophic changes in the vagina, and she's got a neurodermatitis skin condition. She's got moderate anxiety scores and severe hormone-related symptom scores. You can look over the right-hand side and see that even though she's on a thyroid preparation, her thyroid is still out of balance when you do the thyroid testing. T3 is too low, TSH is too high. And then her triglycerides are high, her C-reactive protein is elevated, her glucose and insulin are elevated, insulin resistance is elevated, IGF-1 is low. This is a measure of healthy aging that I use, and then her liver functions are elevated, likely due to the statin, and her vitamin D is too low. So there's a lot of room for improvement here. And too bad her internist hasn't even investigated any of this for the last, whatever, 20 years. We're going to stop there? No, we're going to see what's happening with her hormones. So you can see that her estrogen is low, just in the basement, not even detectable, less than 0.5. Same with progesterone. Testosterone is low, and DHEAS is very low. Her cortisol is high, and then she drops pretty rapidly, and then is pretty flat. And patients that have this kind of pattern, they tell me, if I've got to get something done, I've got to get it done in the morning. Or once I sit down, that's it. I can't get up and get going again. Just kind of run out of gas. Next slide. So here are her diagnoses listed at the top, and how am I going to treat her? Well, I'm going to give her a compound of bioidentical hormones with estrogen. I actually use 2 estrogens, 80% estriol, 20% estradiol, combined with progesterone, combined with DHEA. And compounding pharmacists can put it all together in one cream, and she delivers that to the skin either once a day or twice a day. And I'm going to give her a vaginal suppository of estriol made by the compounding pharmacist to help with the atrophic changes, as well as a vitamin D cream that she's going to rub on once a week onto the fatty area of the skin. These are some of the supplements that I recommend. And because she has been on synthetic hormones so long, we don't need to just stop them like this. If we do, she's going to have severe withdrawal type symptoms, discontinuation syndrome type problems. We have to gradually taper that. sometimes it's 6 months, sometimes it's 9 months, sometimes even 12 months when these women have been on the synthetics long term. And then recommend lifestyle yoga and handwork. Next slide. I'm going to stop her bisphosphonate. First of all, she doesn't even have osteoporosis. And second of all, if you've been on those drugs for 5 years, the data says you can stop it. These drugs are super expensive. They have a lot of side effects. And so I spend more time stopping than starting the bisphosphonates in my patients. Next slide. So she comes back. She's got improvement in most symptoms. She said that she's still got some persistent fatigue. And this is related to caregiver stress. And do y'all have the assisted living centers here for the patients to live in, where they go to the dining room for their meals and they have like a little apartment? Okay. So remember, her mom's got dementia and she was in assisted living. But this is what's happening with this patient as it relates to her mom. If her mom goes to the dining room and doesn't like what they're having for breakfast, she calls daughter. Daughter prepares breakfast and brings it up to assisted living for her mom. Same with lunch, same with dinner. Mom doesn't like the way they do her laundry at the assisted living, so daughter has to carry the laundry back and forth. And also, mom is on the phone with daughter 5, 6, 7, 8 times a day, according to the husband. And he pulled me out in the hall to, give me the download on all this stuff. So it was time to set some limits, as it related to this relationship. You can see her anxiety, depression, and mood scores improved, quality of life scores improved, and we see improvement on those inflammatory and metabolic factors. In fact, everything is coming down into range. Next slide. Her hormone levels, the estrogen, progesterone are in range, DHEAS is in range. Next slide. And so this is what, I have her read a book about mothers and daughters. Deborah Tannen has done a lot of research in this area, and that mother-daughter relationship is one of the strongest relationships that I've ever encountered in clinical practice, and it does persist beyond the grave. And even if the daughter is 70 and the mother is 90, there can still be issues. There are 3 things that mothers criticize their daughters about that make their daughters feel, just total failures. Anybody want to guess what the 3 things are? Yeah, what you're wearing, your wardrobe, your hair, and your weight. So the mom makes a remark about any of those, those are just button pushers. So you're wearing that, and then limitations on the phone visits and on the assisted living visits. And she really needed to get into balance here, because this was very much affecting her personal health and her marriage and her husband's retirement. And he said, Dr. Stevenson, we bought an RV 2 years ago. We never taken it anywhere because she won't leave her mother, and her mother's not coming with us. So giving her permission to set these limits and say, you are still a good daughter if you only talk to your mom once a day. I mean, if it's a huge emergency, they're going to get a hold of you. But if it's, flatly not, it's an abusive type relationship. Get her into support group for caregivers. And I said, you are going to plan a trip and go on a trip in the RV with your husband before your next visit. And if you don't do it, don't even come back and see me. You've got to go. Get in that RV, get out there. Give them your brother's phone number at the assisted living. All right, next slide. So she comes back at 12 months, and her standard mood and pain are improved. She notes occasional hot flashes. It says these are stress-related. Now she's taken 2 trips in the RV, and mom didn't die or, throw a hissy fit. Everything went along smoothly at assisted living. And I know you can't see her biomarkers, but they are in a favorable range. Next slide. You can see her hormone levels are in range, and remember, her mom had a history of uterine cancer, and she was on unopposed hormone for a time, the patient was, and so just looking at the uterine ultrasound, we do not see a problem with endometrial hyperplasia, which is a precursor to endometrial cancer, with the bioidenticals. That's certainly been associated